If you have a vulva, or you've been intimate with someone who does, understanding how the body works is essential. In this video, we'll explore the clitoris, the vulva, the vagina, and yes, the infamous G-spot. By the end, you'll have a clear, science-based explanation of how women's anatomy is built and how it functions. When a baby develops in the uterus, the first 8 weeks look the same for everyone. At this stage, there are no visible genitals. There's just a genital tubercle and a urogenital sinus. Around the 10th week, depending on genetics, the fetus starts developing male or female genitalia. With X chromosomes, the baby develops female anatomy. With XY, male. The genital tubercle becomes the head of the penis in males, or the head of the clitoris in females. Because these parts come from the same embryological tissue, they are called homologous. That means they share the same origin, similar structure, and even similar function. For example, the clitoral hood and the foreskin are homologous. The labia majora, the outer lips of the vulva, are homologous to the scrotum. Everything on the outside is called the vulva. At the very top sits the clitoris, which is full of nerve endings. For most women, clitoral stimulation is the most reliable way to reach orgasm, just as penile stimulation is for men. The clitoris is partly hidden under its hood, known as the prepuce. This hood can move back and forth like the foreskin of the penis. Sometimes it can even stick, which may cause discomfort. The word clitoris comes from the Greek word kleis, meaning key. And while the visible part looks small, most of the clitoris is actually inside the body. It extends into erectile tissue that branches out, very similar to the penis. It has the same blood vessels and nerves. During arousal, the clitoris becomes engorged with blood, essentially an erection. This erectile tissue surrounds the urethral and vaginal openings and even extends under the labia minora, making those areas sensitive too. Below the clitoris is the urethral opening, the exit for urine. Beneath that is the vaginal opening. The vagina is remarkable. It can stretch for childbirth, and during arousal it becomes wider and up to 3 inches longer. Below that is the anus. This is why we often say the female body has 3 openings: the urethra, the vagina, and the anus. Now let's talk about the G-spot. While the clitoris is the main source of orgasm, the G-spot has fascinated people for decades. The G-spot was described in the 1940s by Dr. Ernst Grafenberg. It's located on the front wall of the vagina, about 1 to 2 inches inside. Some describe finding it with a come-hither motion of the finger. But it's not a magic button. It's an area with many nerve endings. Just above this region is the Skene's gland, which is homologous to the male prostate. Just as some men enjoy prostate stimulation, some women enjoy stimulation of the Skene's gland. So is the G-spot the ultimate source of pleasure? For some women, yes, penetration here can lead to orgasm. But for most, clitoral stimulation is still necessary. The clitoris is the main powerhouse of sensitivity, just as the penis is for men. This is the foundation of female anatomy: the clitoris, the vulva, the vagina, and the G-spot. Understanding them helps us appreciate the complexity of women's sexual health. In the next video, we'll explore female ejaculation, another fascinating topic in sexual health and anatomy. Don't miss it. And remember, take care of yourself because you're worth it.